So I've told people I'm being very careful because every other woman up here has a boot on their leg. And I would prefer to walk out of here in the shoes that I came in on. But it's very nice to see all of you, and I'm very honored to be able to recognize a true pioneer in the field of infectious diseases. And I hope actually I can get through this because I've known this person very well since I was an intern at Vanderbilt. And that is William Schaffner. And as many of you know, Bill has dedicated his career to the dissemination of critical information during some of our most challenging times. He officially retired from his position as NFID Medical Director and ACIP Liaison in June of this year, but fortunately for all of us, he continues to serve as an official NFID Medical Spokesperson, bringing clarity where confusion reigns. His unwavering commitment to public health communication has been nothing short of extraordinary. He has tirelessly bridged the gap between the scientific community and media and the general public, ensuring that public health recommendations are not just accessible, but also understood. His expertise has been instrumental in guiding the public through countless public health crises, from influenza outbreaks to COVID-19. Bill is a past president of NFID and has been a leader in many other professional organizations. He's authored or co-authored more than 400 scientific publications, served on the editorial boards of several journals, and his work has focused on all aspects of infectious diseases, including epidemiology, infection control, and immunization. Bill has received numerous awards. I will only mention a few of them. The inaugural 2017 National Vaccine Program Office Upshot Award for excellence in vaccine communication, the 2013 John P. Utz Leadership Award from this organization, from NFID, and the 2009 James D. Bruce Award from the American College of Physicians for distinguished contributions to preventive medicine. He's a professor of preventive medicine and infectious diseases at Vanderbilt, and each month he and Marla Dalton co-host Infectious Ideas, an NFID podcast featuring thought-provoking conversations with leading experts, many of whom are here tonight or will be tapped in the future. So, Bill, it's now my pleasure, if you would like to join me here, to present you with a few tokens of our appreciation for your unwavering commitment to NFID. So first is this lovely crystal, and Bill, you have to see this. This is you getting your influenza vaccine. Look. Isn't that great? And the second, we'll see how I do with this. I'm told I can just throw this back. There we go, sort of. This is a poster with well wishes from many of your friends and colleagues that we have put together here for you. So thank you so much. I think you're using that.
I'm almost speechless, but thank you, Kathy, for your very, very kind words. There isn't any doubt that my association with the NFID has been the source of many personal friendships, as well as enormous professional satisfactions. And profound thanks to all who have provided me this opportunity. To Marla, who has been a terrific partner, and before her, to Len Novick, Bill Martone, Susan Reen. Thanks to all the terrific NFID staff, a small but mighty group. To my friends in public relations, who have so imaginatively assisted our communications. Thanks to all the colleagues in our partner organizations with whom I've had the opportunity to collaborate, and thanks to our friends and supporters in industry. You certainly can't have a vaccination program without vaccines. To all of you, it's been a great ride, and I continue to look forward to working with you going forward as the occasions arise. Now, the NFID promotes all aspects of infectious diseases, but as we know, we've had a special focus on vaccines. So let me give you a brief anecdote that involves my own institution, Vanderbilt, to highlight this. It was a few years ago. Vanderbilt built a brand new pediatric hospital equipped with all the bells and whistles to provide the best pediatric care. But there was a paradox. Our medical center had had a strong, indeed dominant regional reputation for the care of children with a specific disease. Children with this illness from surrounding states were sent to Nashville for their care. Vanderbilt had the faculty expertise, the trained staff, the specialized equipment to care for these patients. Yet here's the paradox. In the new hospital, no space was allotted for the care of these patients. No provision was made for their care. What was that about? What was this disease? Now, I'll not ask this audience to raise their hands in answers, for actually, I would expect a forest of hands to go up. The disease, of course, was polio. There was no need to create a polio ward, as there had been in the old hospital, because there was no more polio. No need for tank respirators and all the nurses 24/7 who could care for the patients. No need for surgeons who were experienced in doing a high tracheotomy so they would not interfere with the collar of the respirator. No need for doctors and pulmonary techs who knew how to wean a patient off the respirator as they regained the capacity to breathe on their own. No more polio, because every child was vaccinated. Every child. Rural, urban, black, white, brown, no matter what language they spoke at home, every child. Polio had been eliminated. I went to medical school because I was inspired to lay on hands and to heal and comfort the sick. As deeply important as that continues to be, I subsequently learned that the prevention of illness, the elimination of disease, was medicine's highest goal, its most noble aspiration. The NFID and all of you are dedicated to making that goal of prevention real. Now, I'm sure that NFID, with Marla as its leader and with my friend and colleague Bob Hopkins as its medical director, will bring this effort to the next level, making this noble aspiration of prevention even more real. Thank you for having given me the opportunity to participate. And onward and upward. Thank you.